Hello everyone, drberkkkaratas. My question is pre-relationship masturbation appropriate or not? I recently read an article about this. That article was a newspaper clipping. It was a newspaper article. When he explained the benefits of masturbation before intercourse, I felt the need to make a video about it. Because what was said was almost completely wrong from start to finish. I couldn't even find out who wrote it. It wasn't written underneath. It was published as an anonymous piece. Our question today is this. Now, there is no scientific study or scientific data regarding pre-relationship masturbation. The first thing I want to say is this. So no one has done such a study. Is it possible? It's not very feasible. This study, but right now there is no such scientific study. So what will we base our discussion on? Based on personal data? Well, based on what people say about their actions too, from our own knowledge and experiences, because we have patients coming in at different times and with varying degrees of conditions, for example, with premature ejaculation. And these are what they tell us. Therefore, we are making an interpretation based on personal experiences, including these. If pre-relationship masturbation is done to prevent premature ejaculation, that's not appropriate. Why is it not appropriate? Because the goal here is to ejaculate quickly without experiencing pleasure. If you remember, I said this. There are a lot of videos about masturbation and premature ejaculation on our channel. I had said this here. If masturbation doesn't mimic a sexual relationship, then you might face some issues in sexual intercourse later on. It definitely needs to mimic the relationship, and you shouldn't do it with the intention of quickly ejaculating whenever it comes to your mind. Since the goal of ejaculation, here is this. It actually seems like it could provide some initial benefit to individuals. But in the later stages, because it creates behavioral disorders, it can trigger even earlier ejaculation in cases of premature ejaculation. So the opposite can also be true. But if masturbation before a relationship is done as a ritual, a foreplay, as part of foreplay with a partner, then we have nothing to say about that. Anyway, what someone does during foreplay is nobody's business. Everyone's normal is their own. So we have no issues regarding this. And of course, if masturbation is done before a relationship, for example, if you're young, it can affect your sexual cycle. Because it's quick, you can achieve hardness again after one ejaculation and ejaculate again. It can happen again, especially if your partner is young and you are young too. But, for example, if you've been married for 15 years and you're 50 years old, in such a case, you ejaculate masturbation before a relationship, but then you might experience issues with hardness in the relationship because your sexual cycle isn't as quick as it used to be and your sexual desire isn't as high as it was before. You might experience issues with hardness in the relationship because you're not as much as you used to be in the old days. You might ask, how do you know this? We know this from here. Now, patients who experience early ejaculation come to us at different times. So, getting married and experiencing early ejaculation in the first year of marriage. I ejaculate early during masturbation. Our patients are coming. There are those who come right after getting married. There are those who come after 5 years of marriage, and those who come after 20 years, especially those who come after 15, 20 years into marriage say this to us. Doctor, I used to do two things. I used to masturbate before the relationship. So the duration was longer in the second relationship. There wasn't any problem. Or I was already ejaculating very quickly in the first relationship. I was going for the second one. The second one was better, but now I don't get as hard as I used to. Actually, the issues with development are not about premature ejaculation. They say, I'm not getting hard. They are coming. So when we question a bit, we actually realize that the problem is premature ejaculation, especially in some individuals. We notice that they are masturbating beforehand to avoid premature ejaculation. As a result, masturbation done before a relationship to prevent premature ejaculation is not an appropriate action. Instead, premature ejaculation or ejaculation is a controllable situation. I've said this many times. We set up a program related to this. It's the world's first and only doctor-supported program that we meet every week. Bode program. You can join this. They have medications. You can use this. You can try sprays or creams. There is hyaluronic acid injection. So we have treatment options. So instead of choosing the wrong behavior, it's better to continue in the right way. The best, thank you,